So the question is, are chiropractors real doctors? You know, we hear this all the time, and I'm just going to give you a timeline of the last 22 years that we've been practicing at Katz Chiropractic, of the things that we've seen in practice where the question has come up, are chiropractors real doctors? So I think we need to go down, take a trip down memory lane to discuss what has happened in both the world of chiropractic and medicine as it relates to the spine. But a quick, brief history. Over 100 years ago, D.D. Palmer developed chiropractic under the notion that the body can heal itself when you remove the interference. In the 5th century BC, Hippocrates described deformities of the spine consistent with scoliosis as well as other types of treatments for it. 5 centuries after the work of Hippocrates, Claudius Galen generated a vocabulary for scoliosis, kyphosis, and lordosis. Now, that was based on medicine. So let's take a look at what happened and what is considered chiropractic. Now, I'm only going to go over the last 22 years that I've seen personally in my office. Now, I am not here to bash medicine. There's time and a place for everything. But let's take a look at what is real medicine. With just kind of taking a step back, we have to talk about Wilk versus the AMA. Dr. Wilk was a chiropractor. Unfortunately, he just passed not too long ago. But we all owe him a debt of gratitude. What Wilk versus the AMA was an antitrust act that the American Medical Association got sued and lost for slandering chiropractors, trying to get people to stop with false accusations. So once this was reported and went to court, the Wilk versus the American Medical Association, this happened in the 7th Circuit in 1990, was a federal antitrust suit brought against the American Medical Association and 10 co-defendants by chiropractor Dr. Chester A. Wilk and 4 co-plaintiffs. It resulted in a ruling against the AMA. I do believe that there was a gag order on it for decades, but now it can be talked about. So this is a timeline that we need to look at, that even though this was 1990 verdict from the courts, this has been going on for decades before. So this is something that chiropractors have always been up against, and we're going to take a look at why is that, and we're going to take a look at some of the things that we've seen in the last 22 years of practice of what real doctors were suggesting and what not real doctors were suggesting. In my 22 years, this is what I've seen. Patients would have back pain, and the medical profession would say bed rest. Chiropractors were like, no, no, no. Bed rest isn't good. You need to keep movement in your spine and your joints. We need to start to pump that area out of the inflammation you heard. Oh, the medical profession, in my experience, would be like, well, don't listen to that chiropractor. He's not a real doctor. Then, several years later, what happened? Multiple studies came out, and I believe even the World Health Organization said, don't do bed rest. It's one of the worst things you could do for back pain. Then the medical profession started saying, hey, we don't think that you should do back pain because it's not good for you. Never, hey, the chiropractors have been saying this because, we weren't real doctors. Then, if you're old enough to remember, in the last 20 some odd years, anytime you went into a warehouse, what did you see? You saw workers that were preemptively wearing back braces, right? Why were they doing that? They were told if you wear a back brace, it could decrease back injuries. Chiropractors, at least what we saw here, we were like, don't do that. Let your body be the brace and be stronger. When you wear a brace, it's going to take the place of your body doing the work, and what will happen? Your body will get weaker. And all we heard was, don't listen to those chiropractors. They're not real doctors. And then what happened? Work comp claims went through the roof for back injuries. Why? Because their back got deconditioned. Oh my gosh, where did that come from? Then the medical profession was like, we shouldn't do that. We determined that wearing a brace isn't really good. Then what happened is we started looking at cortisone, right? Patients were hurt. Patients had pain. Cortisone would come in, boom, they would pump it into the joint, and the patient would feel better. And chiropractors are like, whoa, 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 we want to minimize that. Why? Because the inflammation hurts, yes, but it also has great tissue that comes along with it and cells to come along with it to heal the area. And when you shut that down, the body can't heal. And then what would happen? The medical doctors would be like, they're not real doctors. don't do that. Then what happened? Well, you know, Bo knows what happened because his hip exploded from all the cortisone injections they kept pumping in. Then they came along and they said, hey, no more cortisone injections, or at most only 2 a year. Why? Because it completely destroys the joint and it minimizes long-term healing. Wow, I wonder where else we could have heard that. Obviously, it wasn't from real doctors saying it at first. Then let's talk about spinal surgery. And look, there's a time and a place, and we're great that there's surgeons and there's a time and a place. But let's take a look at what happened just in my 22 years. Patients would have pain. The surgeons would come in and be like, we're going to fuse it. And chiropractors are like, whoa, maybe we should do something a little less permanent, because what happens when you fuse the spine is you're locking an area, and then it's like trying to get rid of that rusty bolt with a small wrench. And then what happens to get rid of that rusty bolt is you need a longer lever arm. And then what's going to happen is the areas above and below can break down, and that's not good. And then they were like, don't listen to those chiropractors, they're not real docs. And then what happened? Oh my gosh, well, there was such a bad outcome with some of these fusions for pain, not due to significant instability or core compression, and they started coming up with a new diagnosis, which was failed surgery syndrome. And then what they found was that the failed surgery syndrome was because the area was locked and the areas above and below became what? Either what's called PJK now, which is proximal junctional kyphosis, leading to an abnormal curvature above the fusion, or ASD, adjacent segment disease. As you fuse those regions and you don't let them move, the areas above and below are under more stress and they break down, and then you need another fusion and another fusion. And then, but when the chiropractors are like, hey, let's try to keep this functioning well, let's see if we can get it to heal, they were like, don't listen to those chiropractors. They're not real doctors. Then what happened? Then the medical profession came out and was like, whoa, these fusions aren't really working well for a lot of these patients. So let's start doing they started in Europe about 10 years before here, let's do artificial disc replacements. Well, why are we doing artificial disc replacements? Well, because it maintains movement. Oh, you mean what the not real doctors were saying, you know, years or decades before? Oh, well, don't listen to them. So now they're doing fake discs to preserve movement. Then what would happen as we went back to the cortisone injections to stop all the inflammation? Now what are they doing? Now they're starting to do PRP, trying to increase the amount of inflammation. What chiropractors were saying was a great idea to do decades ago. Then let's take a look what happened with pain. Oh my gosh, we have back pain, we have neck pain. Medical doctors were doing what? And again, during my 22 years, they were like, hey, we have a great new drug for your back pain. And it's called opioids. We all know what happened with that. The amount of deaths, the amount of destruction in communities. And chiropractors during that time, we were like, whoa, let's not try to cover up your pain. It's not fixing the area. You don't have a opioid deficiency. We want to find out why you have pain. Can we get better movement? Can we check the alignment of your spine? Don't listen to those chiropractors. They're not real doctors. And then we all saw the outcomes of what the real doctors were saying with the opioid pandemic. Then what happens was, for decades, you know, we have, as I showed you here, Claudius Ganlin generated the vocabulary for scoliosis, kyphosis, and lordosis. Chiropractors, especially Don and Dee Harrison of CBP, which is treatment we do in our office, really started to look at the sagittal alignment. And anytime we would bring up sagittal alignment, most of the surgeons and medical doctors and whoever else was like, don't listen to those chiropractors. They're not real doctors. The alignment of your spine doesn't really matter. And then what happened? Now they're starting to see in surgery, hey, we should do a surgery with your spine in better alignment because it results in better outcomes. And the studies all show that the abnormal curvature does result in better health, healing, and outcomes. In fact, we published a study in the Journal of Brain Circulation that shows it decreases blood flow to the brain. So now we're starting to see the medical profession saying, hey, we need to fix the alignment of your spine because we say so. Not that the, not real doctors have been saying it forever. So I think what we need to do as a community is really sit back and say, well, what is a real doctor? Because for us here at Katz Chiropractic, if a real doctor initially prescribed bed rest, didn't look at the mechanics, shut off inflammation that led to worse outcomes, created the opioid epidemic, did fusions that led to a new diagnosis of failed surgery syndrome. If that is what is considered a real doctor, then great. I don't want to be a real doctor, and you can consider to call me that. So maybe what you should do is, instead of going to a real doctor for your spinal issues, maybe you should start with a chiropractor that, as you can see through this timeline, we've been pretty right on the money as it results in spine problems and treatment. So if you have any questions, please give us a call. And remember, we are here to help you to look at the sagittal alignment, to look at the coronal alignment, to look at the stability of your spine. And look, we understand that there is a time and a place, but we want to do a conjoined effort to really determine what is best for you to keep movement, to allow your body to heal by giving it what it needs to heal so that it can heal appropriately. So thanks so much, and I hope you enjoyed this little trip down memory lane.